May is Women's Health Month, and there is no better time to talk about one of the most powerful tools available to every woman, the annual wellness visit. Hi, I'm Dr. Gowdy at Gowdy Family Care Center, and today I want to walk you through exactly what happens at your annual wellness visit. I also want to talk about why it matters and why skipping it, even if you feel pretty fine, is a risk that's not worth taking. An annual wellness visit is not just a checkup, it's a comprehensive health review, and it's designed to catch problems before they become serious. Here's what's typically included: a review of your personal and family medical history, vital signs such as checking your blood pressure, your heart rate, your height, weight, and BMI, your body mass index. Doing some blood work, which would be checking things like cholesterol, your blood sugar, your thyroid function, and more. Screening based on your age, risk factors such as mammograms, pap smears, STI testing or sexually transmitted infection testing, and bone density scans. Reviewing your immunizations and making sure that you're up to date on all vaccines. And those would include vaccines like the Tdap vaccine, which we do every 10 years, your flu shot if it's during the flu season, the shingles vaccine, which is due at the age of 50, which is a series of two vaccines, and things like COVID-19 vaccination, and even hepatitis B. There are indications where you may be due for a booster or if you're at high risk, getting an hepatitis B vaccine. And also a conversation about your overall lifestyle, such as how is your sleep? How many hours of sleep are you getting? How's your nutrition? What is your stress level like? And are you getting adequate physical activity? This is also a protected time to bring up anything that you've been putting off discussing. No concern is too small. Preventive screenings are one of the most critical reasons to come every year. And here are key preventive screenings that we perform based on age groups. For example, if you're in your 20s, that's when we start performing pap smears at the age of 21 to be more specific. Then in your 20s, also when we're checking blood pressure, doing STI screening if needed. And when you're in your 30s, we continue to do pap smear screening, but we also include HPV co-testing, which can extend the pap smear to 5 years as opposed to 3 years. We typically continue to screen for cholesterol, or we do cholesterol screening, thyroid evaluation if you have any symptoms. When you're in your 40s, that's when we typically start doing annual mammograms, also screening for diabetes, and then we continue to perform also cervical cancer screening. In your 50s and beyond is when we typically do the bone density scan, which is screening for osteoporosis. We also do colorectal cancer screening, which starts at 45, and also cardiovascular risk assessments. And these screenings are based on evidence based guidelines, and they're designed to catch conditions when they're most likely to affect a woman at different stages of life. And here some of the reasons as to why an annual wellness visit is not done, which include things like I feel fine, or I'm too busy, or I don't want to hear bad news. And here's what I want you to understand. Many of the most serious conditions affecting women, like heart disease, diabetes, cervical cancer, breast cancer, they often have no noticeable symptoms in their early stages. And by the time you feel unwell or you feel like there's something wrong, treatment becomes more complicated and the outcomes are harder to predict. Your annual visit is how we find those things early when they're the most treatable. And here's something most women don't realize. Most insurance plans cover an annual wellness visit at no cost to you. Like there's no copay, there's no deductible. You just need to come for your annual wellness visits. I like to compare it to when we take our car for maintenance, getting car serviced. Um, it's important to do before there's something wrong with your car. And your health is so much more important, and it deserves at least going into the doctor at least once a year for that annual wellness visit. This Women's Health Month, I want to encourage every woman watching, whether you're 25 or 65, to make that appointment. Not someday, this month. At Gowdy Family Care, preventive care is our priority at every stage of life. And if this video was helpful, please like, subscribe, and share it with a woman in your life who's been putting off her visits. And if you'd like to schedule your annual wellness visit, you can find us at www.gowdyfamilycare.com, or you can give us a call at 706-410-2684. Take care of yourself because you matter. And I'll see you in the next video.